This presentation was prepared by Samina Khalid for HAP 709 Healthcare Database at Health Informatics Program at George Mason University. According to CDC, 84.1 million, or 1 in 3 adults in the United States are pre-diabetic, and 1 in 10 adults will develop diabetes. Some of the risk factors associated with diabetes include obesity, high blood pressure, elevated cholesterol. Diabetes can also increase the risk of stroke, cardiovascular disease, which is considered leading cause of death in the United States. For the purpose of this predictive model, data was extracted from existing database. Age range was narrowed between ages 21 and 99. Distinct patient IDs were used and only unique diagnoses were allowed. According to American Diabetes Association, diabetes mellitus is a metabolic disorder in which there's high blood sugar level over a prolonged period of time, resulting from defect in insulin secretion or insulin inaction. To construct a predictive model, 80% of the data was randomly chosen. A total of 8,636 unique diagnoses were analyzed. Only first occurrence diagnoses were included to calculate likelihood ratio. Likelihood ratio for distinct age group 40 to 99 was also calculated based on 12-month calendar period. Top 10 predictors for diabetes are either directly or indirectly related to diabetes. The most predictive diagnosis for diabetes is pulmonary nephritis. This type of diagnosis is considered obvious predictor and is directly related to predicting diabetes. Some of the other obvious predictors include peripheral angiopathy, insulin poisoning, adverse effect of insulin, and diabetic retinopathy. Rare predictors are diagnoses that are included in predictive model but are rarely associated with predicting diabetes. Important predictors are diagnoses that are strongly associated with diabetes. An important predictor can be a standalone underlying condition in combination with other risk factors. Naive Bayes formula was used to aggregate data from individual patients' diagnoses to predict the overall risk of diabetes. To demonstrate how predicted probability was calculated, let's look at a patient of 699134. This patient had 5 different diagnosis codes. Diabetes likelihood ratio for each category was pre-calculated and stored in the database. According to Naive Bayes formula, the product of likelihood ratio determined the odds of outcome and predict probability of an event. By multiplying the predicted probability, we can find the diabetes predicted probability, which is 0.102. 20% of the data was set aside to validate predictive model. This data was selected randomly and a receiver operative curve was drawn. ROCs are used to graph data using sensitivity and specificity to predict the accuracy of predictive model at various cutoff levels. In summary, predictive modeling is used to predict outcomes of diseases using patients' diagnosis history. Electronic health records allow the use of large samples and allow implementation of decision support system at different levels of medical setting. This is a helpful tool in predicting more accurate and targeted care.